So good afternoon. Every time we hold one of these press conferences, our administration provides an update on public health data for COVID-19 in Massachusetts. I usually do that. Today I'm passing the torch on that one to Secretary Sutters. I think most people know that thanks to the diligence and the efforts of most residents and many healthcare workers and other essential workers here in Massachusetts, we've seen an overall decrease since May in the key metrics that we publish publicly on a daily basis. Positive test rates, number of individuals in the hospital, number of folks in the ICU, and thankfully in the number of new deaths. The notable decline in COVID in Massachusetts, especially in comparison to many other states, has caused some residents to feel a bit too relaxed about the seriousness of this virus. We cannot say this enough. COVID-19 is highly contagious and can be deadly for individuals who are older, who have pre-existing conditions or comorbidity, and in many cases also people of color. And in the past few weeks, we have seen an uptick in COVID-19 in some communities here in the Commonwealth. There have been several reports of big parties in places like Falmouth, Chatham, Winthrop, Wrentham, and Cohasset, to simply name a few. There have also been reports about illegal sports camps and private boat charters where clusters of new cases have quickly developed. And just yesterday, it was reported that a 300-person wedding was held in Gardner that is now being investigated and will likely result in fines. Now, we appreciate that we have asked a lot of the people of Massachusetts since March. Schools were closed. People have been working from home and trying to balance that with childcare. Businesses were closed for months, and special occasions of all kinds have been either rescheduled or canceled. Everyone has been and continues to sacrifice to deal with this heinous virus. People have also stepped up to stop the spread by wearing face coverings, social distancing, and staying home when they feel sick, and using telehealth to get their healthcare needs met whenever it's appropriate. Many of those preventive actions have certainly played a role in slowing the spread here in the Commonwealth, reducing our numbers and allowing us to begin the process of reopening cautiously and vigilantly. But we have to work hard, always, harder in some respects than ever, to contain COVID-19 and keep our economy open for business. We also want to keep this virus out of our communities as we head into the fall so we can give our kids a chance to get back to school. After analyzing the public health data and working with health officials, our administration is announcing a new set of initiatives aimed to continue to contain and stop the spread of COVID-19 and to ramp up enforcement of the many COVID orders we've issued. Some initiatives will be effective statewide. Others will be more targeted to communities that are struggling currently with the spread of COVID in their towns. In some respects, we're entering a new phase in our battle against COVID-19. As I mentioned earlier, we've seen statewide metrics that have been on the decline for several months. But after studying the recent increase in percent positive rates, we'll begin reporting additional town-by-town data starting next Wednesday that shows the spread of COVID-19 at the community level. This information will be posted on a weekly basis. I'd now like to announce some updates with respect to our statewide guidance. Due to that slight uptick in positive cases, we are indefinitely postponing Step 2 of Phase 3 in our reopening process. 5 weeks ago, we laid out new economic sectors that could open in Phase 3. This uptick in cases and reports of people not adhering to the guidance we have put forth here in Massachusetts means we cannot move forward at this time or any time soon in the near future. There have been many reports of pool parties, birthday parties, holiday parties, 4th of July parties, all of which have been documented in great detail by our contact tracing teams that have demonstrated that parties that have been held in people's homes and their backyards have contributed significantly to community spread and new COVID clusters. These parties are too big, too crowded, and people are simply not being responsible about face coverings, social distancing, or any of the major metrics that we've put in place to help people manage the spread of this virus. People who are too familiar with many of their most familiar friends in large gatherings and large settings, indoors or outdoors, when it comes to dealing with this virus, put themselves, their families, and their neighborhoods at risk. And the contact tracing data that we've been working with shows that time and time again, if you give this virus an opportunity to move, it will. The new executive order that I'm signing today will reduce the limit on outdoor gatherings from 100 to 50 people effective Tuesday, August 11th. The inside gathering limit will remain at 25. Folks attending outdoor gatherings must ensure that guests maintain 6 feet of social distance and face coverings are required. We've also extended this guidance to apply to all types of locations and venues on both public and private property. Additionally, we are updating our restaurant guidance to make absolutely clear that alcoholic beverages may only be served for on-site consumption if accompanied by food prepared on-site. Bars are closed in Massachusetts, and bars masquerading as restaurants also need to be closed. Previously, health and inspection officials have been tasked with enforcing many of these COVID orders. Today, I'm authorizing all state and local police officers to enforce these orders, and event hosts who violate these orders will be subject to fines. We've learned a lot about this virus since March, and we've ramped up our resources and guidance, in many cases based on what we've learned, to stop and slow the spread. We've seen a slight uptick upwards across a number of communities here in the Commonwealth, and our goal is to identify those communities through public health data, increased enforcement, and to help amplify awareness in those communities so that the residents and businesses in those communities can practice the vigilance that's required to help them deal with their outbreaks. To execute this mission today, we're announcing the creation of a COVID enforcement and intervention team. This team will be charged with 2 main tasks: ramping up enforcement in key communities and coordinating local intervention efforts at the local level in high-risk communities. Communities will be designated as higher-risk COVID-19 communities based on public health data that evaluates rising trends for metrics like new positive cases and the percentage of positive COVID tests. We'll also announce the higher-risk communities next week. We still have some homework to do in terms of reaching out to and engaging the communities that, based on the public health data, are going to fall into this higher risk category, and we want to make sure we have a chance to talk to them and to start beginning the process of integrating our efforts with theirs before we name names. The COVID enforcement and intervention team will take several steps to address the spread of COVID-19, working with our colleagues again, in many cases, in local government. First, on the statewide enforcement piece, MEMA and the Executive Office of Public Safety and Security will bring together multiple state agencies to coordinate our efforts. This will include local services, Division of Local Services, Department of Public Health, Labor Standards, the Alcoholic Beverages Control Commission, and the Massachusetts State Police. This team will coordinate an increased enforcement effort across the state to ensure businesses and residents are aware of and are following the COVID-19 orders. By authorizing state and local police to enforce these orders, we can not only increase the number of people who will be out there and able to enforce these measures, but also ensure that there are penalties for those who refuse to make the adjustments that so many other people in Massachusetts have made and continue to make. Secondly, the COVID-19 Command Center will identify higher risk communities that we can work with collaboratively to help them deal with their outbreaks. This will be different in every town, but it will include things like helping a town access additional federal relief funds if circumstances warrant it. It will also likely include significant assistance to ramp up enforcement with respect to businesses, face coverings, and gathering orders. High-risk COVID communities may also see restrictions or shutdowns for parks, playgrounds, businesses, or other entities or locations that are believed to be contributing to the spread in those communities. Next, the team will prepare several other resources for high-risk communities, including public messaging and local government support. The purpose of mobilizing these teams in towns that are designated as high-risk COVID-19 communities is to significantly enhance awareness with respect to what's going on in those communities and help people change their behavior. Residents and visitors need to know that COVID-19 is on the rise in those communities and need to have the tools working with us and with their local officials and local boards of health to act accordingly. Our goal is to help parents, families, individuals, and others make the smart decisions that they need to make with respect to their daily activities. For instance, parents everywhere should reconsider having big play dates, and parents in high-risk towns should really avoid spending time with other families, certainly large group gatherings. People should think twice about hosting or attending a gathering of any size, especially when they know the virus has flared up in their community. We hope that more information and a more visible presence with respect to enforcement will help people deal with the very real issues that their communities are facing together and help stop the spread. As I've said, we're starting what I would describe as a new phase in the battle against COVID. Our people here in Massachusetts have worked exceedingly hard over the past several months and have been responsible and collaborative participants in helping us kill the virus. Everybody's sacrificed a lot, from personal to their professional lives. Everybody's been good sports when asked to stay home and wear face coverings. We've been blessed by the grit and dedication of many essential workers and healthcare workers who show up every day to help keep us safe. But now we are seeing the virus escalate in certain communities around the Commonwealth, and we have to put together a plan working together to stop it. We're very grateful for everyone's vigilance and their support, but this fight against COVID-19 is far from over, and all of us need to work together to do the things that have proven to be successful in defeating it previously. And with that, I'll turn it over to Secretary Sutters for a few more details.
Good afternoon, Governor, Lieutenant Governor, Undersecretary. Before I follow up with some additional details on the enforcement and intervention initiatives, I'd like to provide the quick daily update on our numbers. Yesterday, the state reported that 11,555 new individuals were tested for COVID-19. In total, over 1.6 million tests have now been administered. Yesterday, there were 162 new positive cases reported. That brings the statewide total of confirmed cases to 111,533. 32 deaths were also reported. Well, as the governor said, while we have made progress to bring many of the metrics we watch come down since April, we have seen an uptick over the last few weeks. The 7-day average for the positive rate is at 2.1%, which is a 0.4 percentage point increase since our lowest number on July 14th. There are currently 403 patients hospitalized for COVID-19 statewide, and 73 of those are in the ICU. The 3-day average number of patients in the hospital is 384, which is a 6% increase since our lowest number on July 31st. The state's website has had more than 337 hits, and our 211 line received 1,600 calls since Wednesday, and just shy of 100,000 calls. I want to give a shout out this afternoon, to the 211 staff for their efforts since the beginning of the pandemic on responding to the calls and concerns of the public. The Command Center continues to carefully monitor key public health data. As the governor mentioned, we will be providing additional supports to municipalities that are at higher risk for the spread of COVID-19. Through the new COVID-19 Enforcement and Intervention Team, we will offer higher risk communities with the public health support they need to address local spread in their communities. To meet both community and individual needs, we can ramp up the public health resources that we already have in hand, particularly testing, additional tracing, and quarantining support to help people during a period of isolation. The team will work with the communities to add testing capacity or new testing sites depending on the community's needs. As additional cases are identified, we can deploy additional contact tracers from the Tracing Collaborative to support community tracing at the community level. The team will also offer additional supports around quarantining to ensure that people who are in isolation have their basic needs met and have a safe place to isolate, including using our existing isolation and recovery sites. Last month, as you know, we launched the Stop the Spread initiative, which provides free testing to residents currently in 17 communities throughout the Commonwealth. The initiative is a data-driven, focused effort to reduce the prevalence of COVID-19 in communities that are above the state average in total cases, positive test rate, and have experienced decline in testing since April. These sites, of course, are open to all residents of the Commonwealth. Today, we are announcing that we are extending this free testing in those 17 communities through September 12th and are prepared to expand in other communities. We've seen progress in increased testing throughout the Stop the Spread initiative. Last week, Stop the Spread communities tested 56% more residents than the week prior to the program beginning. That's compared to a 41% increase in statewide testing levels over the same period. Some communities have experienced decreases in their positivity rate. In the week before the initiative was launched, Lowell had a 4.0% positive test rate. Last week, for the period July 22nd through 28th, they had a 1.1% positivity rate. And we've seen strong progress in other communities, particularly Lawrence. While we have seen progress in reducing COVID positivity rate in many communities, there's still much more work to do. If new data indicates increased spread elsewhere, we have the ability to expand the Stop the Spread testing initiative into more communities. The Command Center also has active bids out to further expand testing capacity, address geographic access, sometimes we refer to those as testing deserts, and increase in-state lab capacity in Massachusetts. The residents of the Commonwealth have worked hard over these past few months to stop the spread of the virus, and we cannot let the actions of some force all of us to move backwards. The actions we outlined today will help enhance enforcement and interventions in communities that need it the most. But we all have a role to play in stopping the virus. Wear a face covering, practice good hygiene, socially distance. Thank you for your help in stopping this spread. Now I'll turn the podium over to the Undersecretary.
Thank you. Thank you, Governor, and thank you, Secretary Sutters, and all of our state and local partners for the unwavering support you've shown to our communities during this unprecedented crisis. The progress we've made across the Commonwealth in fighting this virus has been remarkable. The overwhelming adherence to guidance on using the masks and face coverings, social distancing, and sanitizing all show the commitment of our communities to protecting one another from COVID-19. On behalf of Secretary Turco and EOPS, I want to thank the countless residents and businesses who have overwhelmingly taken the public health guidance to heart and made it part of their daily life and routine. But we don't have to look far to see states struggling desperately against this insidious virus. And we've all seen the photos and videos of groups disregarding the common sense advisories against the close contact in large groups. This is no time to let our guards down and no time to let up our efforts. Coordinating and empowering this enforcement of critically important public health orders will help us minimize the kind of outbreaks and transmissions that could cost lives and set us back weeks and months. Multi-agency and multi-jurisdictional partnership will allow us to pull every lever and apply every state and municipal resource in support of our shared goal of beating this insidious virus. Fighting the virus is more than a single agency or discipline can do. It takes local and state health officials, law enforcement, licensing regulatory bodies, and others working together. But most importantly, we'll be working with the people of this Commonwealth who will, in every city and town, have shown such remarkable resilience in fighting against this COVID. So we all thank you very much for your support.
Questions on this?
Why not increase fines as well? $300 doesn't seem like a real hefty fine for a venue that held a wedding with hundreds of people in it.
So the first thing I'd say about the hotel issue in Gardner is it's $300 per violation. My guess is that by the time they get done adding up all the violations, it'll be significantly into the thousands of dollars that particular venue will be paying. I mentioned the ABCC as part of my comments as well. I think you're going to see a far more coordinated and significant presence between our colleagues in law enforcement and the ABCC, which has the authority to take licenses away from people and issue much bigger fines as we pursue some of these initiatives, especially the ones that involve hospitality and restaurant venues.
Governor Baker, do you share the concerns of Dr. Birx about the uptick? Do you believe?
Why don't we go here and then we'll go there?
Okay. Like Dr. Birx, do you share a concern that the uptick may be the early warning sign of a surge to come if something isn't done differently? And are you in any direct conversation with Dr. Birx and the task force about this?
I haven't talked to Dr. Birx directly, but we talked to members of the task force quite a bit. In fact, Secretary and I were on the phone with Admiral Giroir discussing a number of things, including the collaborative that we're working with a number of states on to acquire rapid test machines. Say again?
Her comments a day or two ago where she identified Boston as one of 9 cities showing a troubling uptick that, as she and Fauci said, would be the early warning signs of a surge is the next step. That's the first thing they've seen in the past, and then the surge comes if something isn't done differently.
Yeah, I guess what I would say is that my understanding is they were talking about greater Boston. If you just look at the data that's on the weekly report that's put out by the folks at the command center, Boston's numbers are pretty solid. But the area around Boston, you heard Mayor Arrigo from Revere talk about this yesterday. There are a number of communities around Boston that have seen significant increases in positive tests. And back to my comment about the contact tracing, when we start winding these things back, many of them involve private recreational activities where people got together in large groups with people they were familiar with, and they didn't wear masks, they didn't socially distance, and you can just see the point to point to point to point as it moves away from there. And I can't say this enough. I said this the other day, actually, when we were out at MedFlight. My wife and I have basically spent, outside of the people that I work with on a socially distanced basis, we spent time with about 10 people, period, since March. 10. That's been the nature of our so-called social engagement. All right? People need to understand that big groups, especially if people don't distance and don't wear face coverings and don't do any of the things that have been talked about and discussed time and time again, create, in many cases, spread. And that's a big part of why we're enhancing enforcement for local police and state police, and why we're lowering our gathering limit and for outdoor events, and why we're also, at the same time, going to engage a multidisciplinary effort around public health and public safety with the communities that have demonstrated that they are, in fact, higher risk here in Massachusetts.
So you do share that concern?
Governor, will it be hard to use the police to do this when there's been a push to get them back into just the crime business and this whole defunding concept?
I think most local law enforcement operations know their communities pretty well, and we have had complaints to some of our various hotlines where people have said, you know, these people had a big party. I called the locals. Nobody did anything. Well, part of the reason the locals didn't do anything was because they didn't have any authority to do anything. One of the things we're trying to do here is to give local communities, local law enforcement, and the state police the ability to actually issue a fine, which we think in many cases will help with respect to trying to break these things up and hopefully reduce the number of them that are going on out there in the first place.
Governor, the travel restrictions involving Rhode Island going into effect today, there seems to be some confusion along the border about can I go across to go grocery shopping, can I go to a restaurant without filling out the form of quarantine or taking a test? The exemption list does not include that. Is that on purpose, and what are your thoughts about people who are like, my grocery store is 2 minutes down the street across the border, what do I do?
Yeah.
Go to the fast food place down the street.
I don't know if this stuff's been updated on the website yet or not. And I have to admit, I haven't read what's currently on there. But the basic thrust of this is pretty simple. There were a pretty clear set of metrics around what put somebody onto the travel ban list or off of the travel ban list. And Rhode Island's numbers basically went above the threshold. And I reached out to Governor Raimondo and told her and said that as a result of that, we would be implementing this. There are exemptions. There's exemptions for people who commute to and from for work. There are exemptions for transitory activities, grocery shopping, banking, although I would certainly say to most people, if you don't bank remotely and you can figure out how to do it, you probably should. If you do go to Rhode Island, or if you go anywhere in Massachusetts, you better wear a face covering, and I don't think you should be doing recreational activities. If you want to recreate and you don't want to have to abide by the rules associated with the travel ban, stay in Massachusetts. There's plenty of nice places to recreate around here.
But going to the store, if that's your regular grocery store, you would say it's okay?
Yeah, go to the store, do your shopping, wear a face mask, keep 6 feet apart from people, and go home.
People have filled out a travel permit overall?
Yeah, 38,000.
Governor, can you expand on the restaurants, the bars? Are bars masquerading as restaurants? Is that what you're trying to prevent here?
In our conversations with the ABCC and, again, some of our colleagues in local government, one of the things that's come up a number of times is that pretzels and potato chips meets the food service requirement. It clearly doesn't. And what we tried to do with the amendment of the order is make absolutely clear you need to be serving food that's prepared on site, and the people who are in your venue need to order and eat food if they're going to order a drink. And again, some of this came out of conversations we had with the ABCC, and some of it came out of conversations we had with some of our colleagues in local government. But that is clearly not consistent with either the spirit or the intent of what we put in place when we authorized outdoor dining and indoor dining.
Governor, what thoughts are going remote?
Let me just...
With the new initiatives today, what's the guidance going out to the local boards of health, and does any of this affect school openings? Is there any guidance that DESE or any of the related agencies will have to send out about this?
I don't think there's any guidance that DESE will need to send out with respect to this. We certainly, one of the reasons we're not naming communities today is we want to make sure we have a chance to engage them on what we believe we can do to help and what they may be able to do to work collaboratively with us on this, and to also make sure that if there are questions that we think we should answer with them before they start getting phone calls, which they will, we want to be in a position to have those conversations. That's also why this doesn't take effect until Tuesday.
Yesterday, UMass Amherst severely limited number of students living on campus. Should that go across to all the state colleges and universities, just UMass Amherst?
I think one of the, I mean, I talked to the chancellor about this, and he said that, you know, UMass draws from a pretty wide geography, and one of his biggest concerns was they had a lot of kids that were coming from areas that have positive test rates that are significantly higher than anything we have in Massachusetts, and many of our other state institutions of higher ed draw much more from what I would describe as the local community. I mean, if you look at the in-state versus the out-of-state population at a place like, let's take Fitchburg State or Bridgewater, and you look at the same numbers for UMass Amherst, they're basically upside down of one another. And I think that had a lot to do with the chancellor's decision.
Is there
Governor, any chance of
getting students from other states at this time?
Well, we have, we worked pretty hard with some folks to put together a pretty robust testing infrastructure for colleges and universities, and we're expecting, you know, the Secretary and I actually toured the place yesterday, and we're expecting that colleges are going to be testing on a very regular basis their students, which I think is a really good thing.
Governor, any chance of a rollback to 2?
Governor, you mentioned Rhode Island and the metrics that you use there. I'm still a little puzzled about what exactly the positive test rate that they see. Sort of related to that, you're not naming community names today, but
Say again?
you're related to that, you're not naming communities today, but if a community has a higher rate than Rhode Island does, should people stay out of that community?
I certainly want the folks who are living in those communities and the folks who shop or whatever in those communities to know what their circumstance is, so that people will take appropriate precautions. As I said in my remarks, if you're in a community that's got a pretty high positive test rate, I think it'd be a really bad idea if you'd have a big party in your backyard. I mean, I think one of the things here is about creating awareness, because we've done a pretty good job of giving people an idea about where Massachusetts is every single day with respect to all those key measures, and I think that's been really effective. But one of the things, as we started to peel this over the course of the past few weeks, it became pretty clear to us, is there's a group of communities that are clearly having issues and a whole bunch of communities that aren't. And we think it's really important that we make sure people understand how their community is doing. And we're going to have to be, I mean, we can't expect, 6.9 million people to dig around in the data that's available on, this site or that site to figure out exactly what the game is in their particular hometown. And that's on us a little bit to work with our colleagues in local government and help make that a lot easier for people to understand.
Might you roll back?
Because I do think it will affect behavior.
Might you roll back to 2?
The 5% positive test rate.
Might you
There was 2
roll
of them,
back?
weren't there? 6 per 100,000, yeah.
Might you roll back to 2? Some people have suggested you need to roll back, or is that going to hit businesses that aren't the problem, as you suggested in previous times?
Well, we clearly have some issues with bars and restaurants, which we just spoke to. But when you chase a lot of the contact tracing, the biggest issue we have is people who are familiar with people being familiar with them in big groups, and that translating into spread that literally, remember, one of the reasons why the face coverings and the distancing is such a big part of the game here is because even people who get sick with COVID are typically not symptomatic for anywhere from sort of 3 to 7 days. But that doesn't mean they're not contagious, right? And a lot of younger people, especially, may never get symptomatic, but are in fact contagious as well. Now, if you think about a party, take a 4th of July party or even a birthday party, 40 or 50 people in somebody's backyard, moms and dads, the kids, all the rest, nobody wearing a face mask, nobody socially distancing, 1 or 2 people there who are asymptomatic or pre-symptomatic, hugs, handshakes, high fives, dancing, who knows, right? A whole bunch of people walk away from there, little ticking clocks that are going to go off at some point, and they go back home, and they pass it along to a few people in their family, and then we're off. And that has been far more which showed up in a lot of the data I mean, there are people bringing it to work. But the one thing about work in most circumstances is people are socially distancing, they are wearing masks, they're doing the things that we've talked about because employers, generally speaking, don't want to be the source of the problem for their workers.
So rollback's not an answer?
Is it time to pull the plug on in-person classes for local school districts? More and more districts are deciding they're going to go remote. Isn't remote really the safest option at this point, given these current numbers?
Well, I guess I'd say the following. We've had special ed programs running all summer with a fair amount of success. We've had summer school running in many locations over the course of the summer with a fair amount of success. One of the reasons Commissioner Riley asked communities to produce 3 programs, full reopening, hybrid reopening, and a remote reopening, was because he wanted, and I think this was the right thing to do, to be sure that everybody had a general understanding about how they would handle each of those depending upon their circumstances and their situation. The vast majority of the communities in Massachusetts have positive test rates right now and test rates per 100,000 that are way below the Johns Hopkins numbers with respect to where you needed to be to actually go to a full reopening or a hybrid, okay? And even when people talk about reopening on a remote basis to start, the thing I would just say to all of you to keep in mind on this is when we went to remote back in March, all those kids and all those teachers knew each other. You're talking about, for anybody who opens remote straight out of the gate, you're talking about a bunch of kids and a bunch of teachers who won't know each other at all. And honestly, if you think about kindergarten, first grade, second grade, third grade, the grades that generally speaking, most of the tests and the studies that have been done make pretty clear are those least likely to be infected in the first place. Trying to teach those kids how to read remotely, I mean, that's not how you teach kids how to read. You teach kids how to read phonetically with repetition and, individualized attention. And I think in many ways, communities need to look at their data. That's why we're going to start publishing a lot more data that's community specific. And there are many communities in Massachusetts that are in very good shape when it comes to their COVID rates. But there are a bunch that we have work to do on. And we think it's important for people to have those plans. They're all due. The final plans are due on August 10th. And everybody needs to have all of them because they may need them at some point during the year. But I think to wipe away the idea that, everybody should go remote. I mean, first of all, the facts don't support it, the data doesn't support it, and the science doesn't support it. So I'll leave it at that.
Given what you just said and what you announced, I think, at the end of June to make in-person school a priority, is it then kind of contradictory to let every district make their own decision? And you have some districts with not high positivity rates saying we're going to start full remote, when, as you said, the data doesn't support it, and then you have surrounding towns around there picking a hybrid plan, and parents in one town are like, well, what's going on over here? Some teachers have kids in one district who teach in another.
So, just out of curiosity, where'd you grow up?
I grew up in Rhode Island.
Okay, so you're a New Englander.
I am, but I live in Massachusetts now.
What do people love most of all about being from New England when it comes to governance? We like local government, right? And what we have tried to say from the beginning, it's true, right? What we've tried to say from the beginning on this stuff is we will provide guidance and financial resources, which we have done, to our colleagues in local government, and then we really wanted them to make what they thought was the best decision on behalf of their community. And what I'm saying is if you look at the data across most communities in Massachusetts, there's plenty of opportunity there based on the science and what we know for them to consider reopening in some way in person, okay? And I really do worry about kids who are going to be dealing with classmates they don't know if they're fully remote, and with teachers that they don't know and teachers who don't know them. And I'm deeply concerned about the issues associated with kids who actually need to learn how to read. I mean, we've talked a lot about the fact that, You know, kids need to be reading at a certain level by the time they get to 3rd to 4th grade, all right? The way we teach kids how to read historically has been very much an in-person and hands-on activity. And by the way, we'll have a lot more to say about all of this today on Tuesday once we have a chance to connect with and talk to many of our colleagues in local government. Thanks.
Thanks, everybody.